The season for shopping, holiday parties, caroling, all sorts of fun festivities. You might not even realize it, but we're using our voices more than ever this time of year, and that can lead to strained vocal cords. We're joined by Patricia Doyle, a voice therapist and speech pathologist at the UConn Health Center, to learn more about the signs and symptoms. Now, this is not something that just professional singers, actors, and actresses need to be concerned about.
Oh, absolutely not. I mean, we're all using our voices every day when we, a lot of people from the time they get up until they go to bed. And so, during this time of year, we're in a lot of positions where we're using our voices even more than ever. And it's cold and flu season, that adds to the mix, and so there's a lot of risk.
Right. How do you know if your vocal cords are being strained? There are a lot of bugs going around, sore throats, strep, ear infections. They all affect the throat.
Yep, absolutely. So, I mean, if you get a cold, you can get some hoarseness just from the postnasal drip or from, coughing and banging the vocal folds together. And that will usually resolve when you get as the symptoms of the cold resolve. On the other hand, sometimes the actual virus will attack your vocal folds and you'll get what we call acute laryngitis, where you'll completely lose your voice. You just have nothing for a while. And in those situations, you really just have to rest. Your vocal folds are so swollen that they can't vibrate. And if you try and push through that and, sort of force a voice out, then it's like, I always liken it to if you have an injury on your arm and you poke at it and say, gee, I can't imagine why this isn't getting better.
Right.
So you really just
You're just going to be inhibiting the healing process.
Exactly.
If you really don't take a break and ease up.
Right, and then the other problem is that if you're doing that and you are pushing it, then you can create more permanent damage, or damage that requires much longer to resolve.
Now, is there any, talk about the permanent damage. What would that be like?
Well, again, sometimes permanent, sometimes not. But if you're over prolonged excessive banging together of the vocal folds, what you can get are, lesions on the vocal folds, you can hemorrhage into the vocal folds, you can get nodules or polyps, and they're all benign. They're just lesions from the vocal folds banging together too hard. And again, sometimes those will resolve with treatment, and sometimes they need surgery to have them removed.
And what should people do to be proactive if they sort of feel something coming on? Maybe they just have an itchy, dry throat. It's not really a cough yet. It's not a full-blown sore throat or anything worse. What should folks do to sort of condition their throat a little bit more? Well, to prevent it from getting worse.
Right. I mean, you can't prevent the illness, but the things that you can prevent are, or the way you can arm yourself is to hydrate. The fluids help keep the vocal cords moist, and that helps to make them less vulnerable to injury. If sometimes the irritation is from something like acid reflux, which is acid that comes up from the stomach, and we normally think about heartburn, but in our field we think about when it goes even past the esophagus and gets up into the throat. And the tissues of the throat really aren't designed to tolerate that acid, and so they can become inflamed, and it feels uncomfortable, and then that can affect the voice as well. So managing reflux, watching, all the rich foods that we're exposed to this time of year, trying to, limit those, and also if you know that you've really indulged, to use some sort of an over-the-counter reflux medication, or if you're on prescription, obviously, to follow that.
Right. And it's not a bad idea just to take a break from talking altogether for about maybe 15-20 minutes a day.
Yes, taking frequent vocal breaks. If you have a lot of voice use, it's really good to, set aside some time where you just have a little downtime for your voice, and that can really help you to sort of stay the distance.
All right, great advice. Thanks, Patricia.